Compare and contrast transformational leadership and servant leadership in the context of healthcare quality improvement. Which model is more effective in fostering a culture of accountability? Answer: transformational leadership. This leadership style focuses on inspiring and motivating staff to achieve higher levels of performance. In healthcare, transformational leaders set a vision for quality improvement and motivate team members to innovate and take ownership. They emphasize accountability by modeling behavior, empowering staff, and aligning individual goals with organizational objectives. This creates a culture where employees are committed to quality outcomes and personal responsibility is encouraged. Servant leadership. Servant leaders prioritize serving others, focusing on the needs of their team and patients. They demonstrate empathy and listening and emphasize collaboration, ethical decision-making, and building trust. In healthcare quality improvement, servant leadership helps foster an environment where staff feel valued and supported. The emphasis is on nurturing a collaborative and supportive culture, which can indirectly improve accountability through empowerment and engagement. Effectiveness in fostering accountability. Transformational leadership is typically more effective in fostering accountability as it emphasizes setting clear goals, modeling behaviors, and creating an atmosphere of ownership. While servant leadership is essential for trust building and creating a supportive environment, transformational leadership ensures that employees are focused on achieving measurable quality outcomes. Relevant guidelines. The Institute for Healthcare Improvement (IHI) emphasizes leadership in driving sustainable improvement, where both transformational and servant leadership play important roles depending on the organizational context. Why is the Hospital Consumer Assessment of Healthcare Providers and System (HOPS) survey considered a vital tool in measuring patient experience? Discuss its components and limitations. Answer: the HCA-HPS Hospital Consumer Assessment of Healthcare Providers and Systems survey is crucial for measuring patient experience because it provides standardized comparative data across hospitals, allowing for meaningful benchmarking. By gathering patient feedback on their experiences, hospitals can identify strengths and areas needing improvement in patient care. Components of HOPS. Communication with doctors and nurses measures the quality and clarity of interactions with healthcare providers. Responsiveness of hospital staff assesses how promptly hospital staff respond to patient requests. Environment focuses on cleanliness, quietness, and the physical environment of the facility. Pain management and medication explanations evaluates how well staff manage pain and explain treatments. Discharge information measures clarity in discharge instructions, including follow-up care. Limitations. Response bias. Not all patients may respond, and certain demographic groups, e.g. elderly, low literacy, may be underrepresented, leading to skewed results. Focus on hospitalization. The survey is limited to inpatient care, neglecting the experiences of patients in outpatient or long-term care settings. Cultural and socioeconomic factors. Responses may not capture the diverse perspectives of patients from different cultural or socioeconomic backgrounds. Relevant guidelines. The Centers for Medicare and Medicaid Services (CMS) requires the use of HCA-HPS as part of the hospital value-based purchasing program, linking patient satisfaction to reimbursement rates. Maria, a healthcare quality manager, notices a recurring issue where patients with chronic conditions struggle to adhere to treatment plans due to low health literacy. Maria decides to implement a shared decision-making model to address this issue. What steps should Maria take to successfully integrate a shared decision-making model, and how can this improve patient outcomes? Answer: to implement a shared decision-making model, Maria should begin by assessing the health literacy levels of her patient population. She can use surveys or screenings to understand the gaps in knowledge that contribute to low adherence. Based on the assessment, Maria should develop tailored education materials, ensuring they are culturally appropriate, easy to understand, and accessible to all patients, including those with low health literacy. Training healthcare providers is essential. Clinicians should be equipped with skills to facilitate discussions where patients can express preferences, concerns, and values using decision aids such as pamphlets, videos, or interactive apps. Can help make the decision-making process more transparent and engaging. Moreover, Maria should create a feedback loop to monitor patient engagement and adherence, tracking how the shared decision-making process influences treatment outcomes. This will help refine the model for future use. Improvement in outcomes. Patients who actively participate in their care decisions are more likely to understand and accept treatment plans, leading to higher levels of adherence. When patients feel empowered to make decisions aligned with their values, it improves satisfaction, trust in healthcare providers, and overall health outcomes. Explain how addressing patient complaints effectively can enhance overall satisfaction. What principles should guide the complaint resolution process? Answer: addressing patient complaints effectively is a fundamental aspect of improving satisfaction. When complaints are handled well, patients feel valued and heard, which enhances trust in the healthcare system. Effective complaint management can also identify areas for improvement, helping to refine care processes. Principles for effective complaint resolution. Transparency. The process for filing and resolving complaints should be clear to all patients, and they should be informed of how long it will take to address their concerns. Empathy. Healthcare providers must listen attentively and empathetically, acknowledging the patient's frustration without becoming defensive. Accountability. It's crucial for healthcare organizations to take responsibility for mistakes and communicate the steps being taken to correct them. Follow-up. After resolving a complaint, follow-up with the patient ensures that their concerns were properly addressed and demonstrates the organization's commitment to improvement. Discuss 3 strategies for promoting a culture of excellence and accountability in healthcare organizations. Answer: promoting a culture of excellence and accountability is essential for improving quality outcomes in healthcare. Below are 3 effective strategies. Leadership commitment. Leaders must demonstrate a commitment to quality improvement by setting a clear vision and holding themselves accountable for outcomes. This sets the tone for the entire organization, encouraging staff to adopt similar standards. Clear performance metrics. Establishing clear, measurable goals linked to quality outcomes allows healthcare providers to track progress and take corrective actions when needed. Performance metrics should be regularly reviewed and used as part of performance evaluations. Continuous learning. Encouraging ongoing training and education helps staff stay informed about the latest practices and innovations in healthcare. A learning culture fosters adaptability and ensures that employees have the necessary tools to deliver high-quality care. Relevant guidelines. The Baldrige Excellence Framework provides a set of criteria that healthcare organizations can use to foster a culture of quality improvement, including leadership and continuous learning. What are the challenges of managing conflicts in quality improvement teams, and how can they be resolved? Answer: conflicts in quality improvement teams can arise due to differences in perspectives on clear goals or resistance to change. Some common challenges include divergent goals. Team members may have different ideas about what constitutes success or may prioritize different aspects of the project. Miscommunication. Poor communication can lead to misunderstandings, which may escalate into conflict. Resistance to change. Some team members may resist new initiatives or methods due to comfort with existing processes. To resolve conflicts, healthcare organizations can use the following strategies. Conflict mediation. A neutral facilitator can help resolve disagreements by fostering open communication and encouraging compromise. Clear objectives. Setting common goals and aligning team members around these objectives helps reduce misunderstandings and misaligned priorities. Active listening. Encouraging open dialogue and ensuring that everyone's opinions are heard fosters mutual respect and cooperation. Why is change leadership crucial in healthcare quality improvement, and what are the steps involved in leading successful change initiatives? Answer: change leadership is crucial for guiding healthcare organizations through the complexities of quality improvement initiatives. Change leaders are responsible for ensuring that improvements are not only implemented but sustained over time. Successful change leadership aligns the organization's vision with the desired outcomes and involves all stakeholders in the process. Steps in leading change. Assess readiness for change. Identify potential barriers and gauge the organization's readiness to implement change. Develop a vision. Clearly define the desired change and articulate how it will benefit both the organization and the patients. Engage stakeholders. Involve staff and other stakeholders early in the change process to gain their support and input. Monitor and adapt. Continuously monitor the implementation and make adjustments as needed to stay on track with the desired outcomes. What design principles should be followed to create a patient-centered care environment? Answer: a patient-centered care environment prioritizes the comfort, dignity, and preferences of patients. The design of healthcare facilities should align with these principles. Accessibility. Ensure that all areas of the facility are easy to navigate for patients with various mobility needs. This includes clear signage and accessible bathrooms. Comfort. Design spaces that reduce stress and promote healing. Comfortable waiting areas, private rooms, and soothing colors can contribute to a positive experience. Privacy. Respecting patient privacy is crucial. This can be achieved through soundproofing, private consultation rooms, and secure handling of personal information. Relevant guidelines. The planetary model advocates for patient-centered care design, emphasizing a holistic approach that improves both the physical and emotional health of patients. How does fostering a culture of accountability improve healthcare quality? Provide examples. Answer. A culture of accountability ensures that every team member understands their role in delivering quality care and takes ownership of their performance. By fostering such a culture, healthcare organizations can improve outcomes, reduce errors, and increase patient satisfaction. Examples of fostering accountability include regular audits, conducting audits to monitor performance and identify areas for improvement, transparent reporting, sharing performance data with staff ensures everyone is aware of the organization's goals and challenges. Peer review systems, encouraging staff to review each other's work and create a culture where everyone feels responsible for the quality of care. Relevant guidelines. The Joint Commission sets standards for accreditation that emphasize accountability in healthcare organizations, highlighting the need for clear responsibilities and oversight in patient care. Discuss the relationship between health literacy and patient outcomes. How can organizations address gaps in health literacy? Answer. Health literacy significantly impacts patient outcomes as patients with lower literacy levels often struggle to understand medical instructions, leading to poor adherence to treatment plans. Lower health literacy is associated with higher hospitalization rates, lower use of preventive services, and increased medical costs. To address gaps in health literacy, healthcare organizations can use plain language, simplify medical jargon and use language that is easy for patients to understand, provide visual aids, utilize diagrams, pictures, and videos to enhance understanding, offer patient education sessions, provide opportunities for patients to ask questions and receive answers in a supportive environment. Relevant guidelines. The U.S. Department of Health and Human Service (HHS) advocates for health literacy strategies as part of the National Action Plan to improve health literacy, aiming to enhance understanding and decision-making in healthcare. Explain how the concept of sentinel events is used in healthcare to drive improvements in patient safety. What is the relationship between sentinel events, reporting requirements, and risk mitigation strategies? Answer. A sentinel event is an unexpected event in healthcare that results in death, serious physical or psychological injury, or the potential for such outcomes. These events are critical indicators of underlying systemic failures and as such are a catalyst for improvement efforts. Sentinel events, as defined by the Joint Commission, must be thoroughly investigated to identify root causes and prevent recurrence. Reporting and risk mitigation. Reporting. While reporting sentinel events to the Joint Commission is voluntary, many healthcare organizations are bound by regulatory and accreditation requirements to report such events internally and to authorities when necessary. Reporting helps create transparency and fosters a learning environment. Root cause analysis, or CA. RCA is a systematic approach used to analyze sentinel events and identify systemic issues, allowing healthcare providers to implement corrective actions. Risk mitigation. Once root causes are identified, healthcare organizations can mitigate future risks through process redesigns, staff education, and changes to policies. By focusing on preventing the recurrence of similar events, healthcare systems can improve safety. Describe how Pareto analysis can be applied in healthcare to address medication errors. Explain the 80-20 principle and how it guides resource allocation. Answer. Pareto analysis is grounded in the 80-20 principle, which asserts that 80% of the problems come from 20% of the causes. This principle is applied in healthcare to focus improvement efforts on the most critical issues that cause the majority of adverse events, such as medication errors. Application in medication errors. Data collection. The first step is collecting data on medication errors, e.g. wrong drug, wrong dosage. Errors are categorized by their type or cause. Pareto chart. A Pareto chart is created by plotting the frequency of different types of medication errors, with the most frequent errors appearing first. The chart visually demonstrates which errors are most common. Identification of key issues. According to the 80-20 rule, the analysis may show that a small percentage of errors, e.g. incorrect dosages, contribute to the majority of adverse events. Resource allocation. Based on the Pareto analysis, healthcare organizations can prioritize interventions for the most frequent errors. For example, focusing on training staff in proper dosage calculations or introducing technological solutions such as computerized physician order entry. CPO systems can significantly reduce medication errors. Dr. Maria is the new Chief Quality Officer at a hospital where staff survey results reveal a low score on the AHRQ Patient Safety Culture Survey in the dimension of openness to communication. Staff feel hesitant to report near misses for fear of punishment. What strategies should Dr. Maria implement to improve the safety culture, specifically addressing communication barriers? Answer: to improve communication and create a just culture, Dr. Maria should consider the following strategies. Promote a just culture. Dr. Maria should educate staff about the importance of distinguishing between human errors and reckless behaviors. She can introduce training that emphasizes learning from errors rather than blaming individuals. A just culture focuses on improving systems and processes rather than penalizing staff for honest mistakes. Leadership engagement. Leadership must be visibly committed to safety and open communication. Dr. Maria should model this commitment by encouraging open discussion of errors and supporting transparency in reporting. She could regularly participate in safety rounds, discussing safety issues openly with staff to reduce fear of retaliation. Feedback loops. Dr. Maria can create a closed-loop feedback system where staff receive updates on actions taken after reporting incidents. This reassures them that their reports are taken seriously and leads to concrete improvements. Policy development. She should revise the hospital's policies to protect whistleblowers and clearly outline procedures for reporting without fear of punishment. This could involve introducing anonymous reporting channels and safe reporting mechanisms. Explain the differences between flowcharting and process mapping in healthcare. How do these tools contribute to identifying inefficiencies in patient care workflows? Answer: flowcharting and process mapping are both tools used to visualize and understand processes in healthcare settings, but they serve different purposes and offer distinct levels of detail. Flowcharting definition. A flowchart is a simplified diagram that represents the sequential steps of a process, often using standardized symbols such as ovals for start and end points, rectangles for steps, and diamonds for decision points. Use in healthcare. Flowcharts are useful for documenting straightforward linear processes such as patient intake or the medication administration process. They help identify bottlenecks or redundant steps. Process mapping definition. Process mapping is a more detailed and comprehensive technique that goes beyond flowcharting. It includes information about roles, systems, resources, and time spent at each step. Process maps often incorporate a wider view of the process, showing interactions across different departments or teams. Use in healthcare. Process mapping is ideal for understanding complex multi-step processes such as patient discharge where multiple departments are involved. It highlights inefficiencies, redundancies, and communication gaps. Contribution to identifying inefficiencies. Both tools allow healthcare organizations to visually identify where delays, errors, or redundancies occur in workflows. Process mapping is more beneficial for complex workflows, while flowcharting is effective for simpler, linear processes. By visualizing processes, healthcare providers can target specific areas for improvement, streamline workflows, and reduce delays, ultimately improving patient care and safety. Discuss the role of failure mode and effects analysis (FME) in preventing adverse events. How does FME differ from root cause analysis? Answer: FME is a proactive tool used to identify potential failure points in a process before they occur. It systematically evaluates processes by identifying possible failure modes, their effects on the overall system, and the likelihood of their occurrence. This method prioritizes failure modes by their risk priority number (RPN), which is calculated based on severity, likelihood, and detectability. How FME works: identify process steps. Begin by breaking down the process into smaller, manageable steps. Identify potential failures. For each step, list possible failure modes. Wrong medication administer. Evaluate impact. Assess the consequences and likelihood of each failure mode occurring. Develop mitigation strategies. Implement corrective actions for the highest priority failures, reducing the risk of adverse events. FME is preventive, identifying risks before they manifest, allowing organizations to modify processes and systems accordingly. RCA versus FME, root cause analysis. RCA is a reactive tool used after an adverse event has occurred to identify the root cause. RCA looks at specific incidents to determine what went wrong and how to correct it. FME is proactive, focusing on identifying vulnerabilities before any failure occurs and preventing potential adverse events by addressing weaknesses in the process. Both tools are essential in creating a safer healthcare environment, with FME focusing on prevention and RCA used for corrective actions after an event. Why is medication reconciliation critical in reducing adverse drug events? ADES. Identify 3 strategies for effective implementation. Answer: medication reconciliation is the process of ensuring that a patient's medication list is accurate at every transition of care, e.g., admission, discharge. It is vital in reducing adverse drug events, ADES, which occur when medications are not properly managed, leading to errors, interactions, or incorrect dosages. Importance of medication reconciliation. Medication errors, particularly during transitions of care, are a major source of ADES. Reconciliation ensures that healthcare providers have an accurate and complete list of a patient's medications, reducing the risk of duplications, omissions, or incorrect doses. Strategies for effective implementation. Standardized processes utilize electronic health records (EHR) systems to maintain an up-to-date medication list and ensure consistency across care providers. Patient engagement. Actively involve patients in the process by encouraging them to bring all their medications to appointments and informing providers about any over-the-counter drugs or supplements they are taking. Multidisciplinary teams ensure that pharmacists, physicians, and nurses collaborate in the reconciliation process, leveraging their expertise to cross-check and verify the medication list. Robinson, the surgical team leader, notices inconsistent use of the WHO surgical safety checklist in his department. What steps should Mr. Robinson take to ensure compliance and improve surgical outcomes? Answer: Mr. Robinson should take a leadership role in fostering a culture of safety and consistency. The following steps are essential: reinforce training, ensure all surgical staff are trained on the importance of the WHO surgical safety checklist and its correct use. Leadership support. Mr. Robinson should model compliance by consistently using the checklist and emphasizing its importance to the surgical team. Audits and feedback. Conduct regular audits to track checklist use and provide feedback to staff. Reward teams who consistently follow the checklist to encourage adherence. Multidisciplinary involvement. Involve anesthesiologists, surgeons, and nurses in discussions to reinforce teamwork and the value of checklist adherence. By integrating these steps, Mr. Robinson can ensure the checklist is used consistently, leading to improved surgical safety outcomes. Explain how control charts can be used to monitor infection rates in a hospital. Differentiate between common cause and special cause variations. Answer: control charts are statistical tools used to monitor a process over time and detect variations in infection rates. The chart plots data points in chronological order, allowing healthcare providers to visualize trends and identify any unusual patterns. Types of variations. Common cause variations. These are inherent variations that occur naturally within the system, e.g., daily fluctuations in infection rates. They are expected and can be controlled through systemic process improvements. Special cause variations. These are unusual, often preventable deviations from the norm, e.g., a sudden spike in infections due to a contamination issue. Special causes indicate problems requiring immediate attention. By using control charts, healthcare providers can distinguish between routine fluctuations and significant issues, allowing for early intervention when special cause variations are detected, thereby improving infection control. How can stakeholder engagement improve the adoption of quality improvement initiatives? Provide examples of effective communication strategies. Answer: engaging stakeholders early in the process is crucial for the successful adoption of quality improvement initiatives. By involving key individuals and groups, organizations can align efforts, reduce resistance, and gain valuable insights into potential challenges. Effective communication strategies. Executive buy-in. Obtain leadership support early on, ensuring they are committed to the initiative and will communicate its importance across the organization. Transparent communication. Regularly update stakeholders through meetings, emails, and reports to keep them informed of progress, challenges, and successes. Inclusive planning. Involve frontline staff in decision-making to ensure their concerns and ideas are considered. Fostering a sense of ownership and commitment. Stakeholder engagement helps secure resources, facilitates smoother implementation, and drives a culture of continuous improvement. How does risk stratification help in prioritizing patient care in emergency departments? Explain the role of triage in this process. Answer: risk stratification involves assessing the severity of a patient's condition to prioritize care based on urgency. In emergency departments (EDs), this process helps ensure that patients with the most critical needs receive timely attention. Role of triage. Triage is the process used to categorize patients based on the severity of their conditions. It is the first step in risk stratification, where patients are classified into levels, e.g., immediate, urgent, non-urgent, to ensure that those in critical conditions are treated first. By using risk stratification, DS can efficiently manage patient flow, reduce waiting times, and ensure that resources are allocated effectively to those who need them the most. How can healthcare organizations ensure the accuracy and completeness of clinical data used in quality improvement initiatives? Answer: to ensure the accuracy and completeness of clinical data, healthcare organizations must adopt robust data governance strategies, which include standardization of data entry protocols, establishing uniform data entry procedures to prevent variability in documentation, for example, using structured templates in electronic health records, regular data audits, conducting routine data quality checks to identify and rectify inconsistencies or missing data, training for staff, providing comprehensive training to healthcare staff on accurate documentation and the importance of data integrity, use of technology, implementing automated systems such as HR alerts to flag incomplete or inconsistent entries, compliance with privacy laws, adhering to regulations such as HIPAA to ensure data security, which builds trust and supports the availability of accurate information. Explain the methodology used in conducting a clinical audit. How do the objectives of clinical audits align with healthcare quality improvement efforts? Answer: the methodology for conducting a clinical audit typically involves several key steps. Defining the audit criteria. The first step is to set specific, measurable, and evidence-based criteria that define optimal care or desired outcomes. Data collection. Information is gathered on current practices, often through patient charts, databases, or direct observation. Data comparison. The collected data is compared with the defined standards or benchmarks to identify any gaps in practice. Analysis. This step involves evaluating the causes behind the gaps and determining whether they are due to system failures, lack of resources, or knowledge deficits. Implementing improvements. Based on audit findings, action plans are developed to address identified issues. Reauditing. After improvements have been implemented, the audit cycle is repeated to assess the effectiveness of changes made. The objectives of clinical audits focus on improving patient care quality, ensuring compliance with clinical guidelines, reducing inefficiencies, and ultimately improving health outcomes by aligning practice with evidence-based standards. How do the ACA initiatives aim to improve healthcare quality, and what is their impact on healthcare providers? Answer: the Affordable Care Act includes several initiatives designed to improve healthcare quality, primarily by focusing on reducing costs and enhancing patient care. Some key ACA initiatives include Accountable Care Organizations (ACOs). These organizations are designed to foster collaboration among healthcare providers to ensure that patients receive coordinated care. ACOs are incentivized to improve health outcomes while controlling costs. Providers are rewarded for improving quality rather than increasing volume, which incentivizes better clinical practices and efficiency. Patient-centered medical homes (ECMH). This model focuses on providing comprehensive primary care, ensuring that patients have a continuous relationship with a personal physician. The initiative promotes preventive care and the management of chronic conditions, ultimately aiming to reduce hospital admissions and improve overall patient outcomes. Quality Payment Program (QPP). Under the QPP, healthcare providers are incentivized to participate in value-based care through mechanisms like the Merit-Based Incentive Payment System (MIPS) and Alternative Payment Models (APAMs). These programs reward healthcare providers for improving care quality and reducing unnecessary spending. How can healthcare organizations identify gaps and inefficiencies during an operational audit, and what are the best practices for developing actionable audit reports? Answer: to identify gaps and inefficiencies during an operational audit, healthcare organizations need to carefully analyze both the structure and processes of care delivery. The audit should focus on areas such as workflow, resource utilization, and clinical outcomes. Here's how gaps and inefficiencies are identified. Data review. The first step is to collect and analyze operational data, including patient wait times, staff workload, resource allocation, and clinical outcomes. This data can help uncover inefficiencies in service delivery or misallocation of resources. Benchmarking. Comparing performance data against industry standards or best practices can highlight areas where an organization is underperforming. For example, comparison against national quality metrics or similar institutions' performance can reveal operational shortcomings. Process mapping. Auditors often use tools like flow charts or process maps to visualize workflows and identify steps that may be redundant or unnecessary, contributing to delays or increased costs. After identifying gaps, the audit report should be both comprehensive and actionable. Best practices for developing an actionable audit report include Clear presentation of findings. The report should be organized with clear headings and a logical flow, presenting key findings along with evidence-based data, recommendations. Specific, measurable, and time-bound recommendations should be provided to address the identified issues, focusing on process improvements, resource allocation, or policy changes. Prioritization. The report should prioritize actions based on their potential impact on improving quality and operational efficiency. Mr. Roberts is a healthcare provider who has recently joined a group practice. He is unfamiliar with the merit-based incentive payment system MIPS under the Affordable Care Act. His practice has been providing high-quality care, but Mr. Roberts is unsure how he will be evaluated under this system. What steps should Mr. Roberts take to ensure his practice meets MIPS requirements and maximizes reimbursement? Answer: Mr. Roberts should take the following steps to ensure his practice meets MIPS requirements and maximizes reimbursement under the ACAS Merit-Based Incentive Payment System MIPS. Understand the MIPS components. MIPS evaluates healthcare providers across 4 performance categories. Quality measures performance on a range of clinical quality measures, CMS, such as patient outcomes and process measures. Improvement activities encourages providers to engage in activities that improve clinical care, such as care coordination and patient safety initiatives. Promoting interoperability involves the use of certified electronic health records (AERS) to enhance care coordination and patient engagement. Cost evaluates the total cost of care provided to patients, factoring in efficiency and resource use. Review the performance thresholds. MIPS has specific performance thresholds that must be met to avoid penalties and ensure reimbursement. Mr. Roberts should familiarize himself with these thresholds to understand what level of performance is required. Track and report data. Mr. Roberts needs to ensure that his practice is accurately tracking and reporting relevant data across all MIPS categories. This can be done through the Practice HR system or using specialized software designed for MIPS reporting, engaging quality improvement activities, participating in quality improvement initiatives such as improving patient outcomes, reducing remissions, or enhancing care coordination will not only benefit patient care but also contribute to the MIPS improvement activities category. Consult with an MIPS expert. Given his unfamiliarity with MIPS, Mr. Roberts should consider consulting with a MIPS expert or utilizing CMS resources to ensure that the practice is on track to meet MIPS requirements. After completing a clinical audit, what steps should healthcare organizations take to implement changes, and how can they ensure sustainability of these changes? Answer: post-audit implementation of changes involves several critical steps to ensure improvements are effectively integrated into practice. Action plan development. Based on audit findings, an action plan should be created that outlines specific improvements, responsible parties, timelines, and required resources. The plan should address root causes of identified issues, whether related to clinical practice, system inefficiencies, or staff performance. Stakeholder engagement. Engaging key stakeholders, including clinical staff, administrators, and patients where applicable, is crucial to ensure that the proposed changes are understood, accepted, and supported. Leadership should champion the change to foster buy-in and ensure smooth implementation. Training and education. If the audit identifies a lack of knowledge or skills as a barrier to quality care, targeted education and training programs should be developed. This could include continuing education, workshops, or online training modules. Monitoring and evaluation. To ensure that changes are effective, organizations should establish ongoing monitoring systems. Regular follow-up audits or performance reviews can assess the impact of changes and determine if further adjustments are needed. Discuss the purpose of alternative payment models (APAMs) in the context of healthcare reimbursement. How do APMS incentivize healthcare providers to improve quality while controlling costs? Answer: alternative payment models (APAMs) are designed to provide healthcare providers with financial incentives to deliver high-quality care at low costs, as opposed to traditional fee-for-service (FFS) models that reimburse providers based on the volume of services delivered. APMS aim to shift the focus from quantity to value. Some key features include risk sharing. APMS often involves some form of risk sharing where providers are financially responsible for meeting certain quality and cost targets. This could involve downside risk where providers face financial penalties for exceeding cost benchmarks, or upside potential where providers can share in savings if they meet cost and quality goals. Bundled payments. One common APM is the bundled payment model where providers receive a single payment for all services related to a specific episode of care, e.g. hip replacement surgery, patient-centered care, PMS encourage providers to focus on patient outcomes rather than the volume of services provided. Quality metrics. Providers participating in a PMS are often evaluated based on quality metrics such as patient satisfaction, clinical outcomes, and patient safety. What are the key elements that should be included in an actionable audit report for an operational audit in a healthcare organization, and how do these elements contribute to improving quality? Answer: an actionable audit report should include the following key elements to ensure clarity and effectiveness in driving improvements. Executive summary. A concise summary of the audit objectives, methods, findings, and recommendations. Findings and evidence. The report should detail the audit findings supported by relevant data and evidence. Root cause analysis. Identifying the root causes behind the issues found during the audit is essential. This could involve analyzing workflow inefficiencies, communication breakdowns, or gaps in training. Recommendations. Concrete, actionable recommendations should be provided to address each finding. These recommendations should be specific, measurable, and aligned with best practices. Timeline for implementation. The report should include a proposed timeline for implementing each recommendation, monitoring and follow-up plan. To ensure that changes are sustained, the report should outline a plan for monitoring and evaluating the effectiveness of implemented changes. What role does the CMS Innovation Center play in improving healthcare quality, and how do its programs support the transition to value-based care? Answer: the CMS Innovation Center, established by the Centers for Medicare and Medicaid Services (CMS), plays a key role in testing and scaling innovative healthcare delivery models. Its goal is to improve healthcare quality while reducing costs. Key aspects of its role include testing new payment models. The CMS Innovation Center tests new payment models that incentivize providers to improve quality and reduce costs. These models often focus on value-based care rather than fee-for-service models, which align reimbursement with patient outcomes. Support for accountable care organizations, ACOs. The Innovation Center promotes the use of ACOs, which are groups of healthcare providers that take collective responsibility for the quality, cost, and overall care of a defined population. Chronic care management. Programs like the Comprehensive Primary Care Path (CPC) initiative focus on improving care for patients with chronic conditions. These programs emphasize preventive care and the use of data to improve care coordination. Scaling successful models. The Innovation Center identifies successful models from pilot programs and works to scale them for broader implementation across the Medicare and Medicaid systems. Explain the importance of cost evaluation in healthcare quality improvement initiatives. How can healthcare organizations balance cost control with quality care? Answer: cost evaluation is an essential component of healthcare quality improvement (CHI) because it allows organizations to assess the financial sustainability of their care delivery models. Healthcare organizations must balance cost control with quality care by adopting strategies that focus on both efficiency and effectiveness. Cost-effectiveness analysis. Healthcare organizations use cost-effectiveness analysis to evaluate the benefits of interventions relative to their costs. This allows organizations to identify practices that offer the greatest benefit per dollar spent, thus optimizing resource allocation. Process optimization. By streamlining processes and eliminating inefficiencies, e.g., reducing unnecessary tests or procedures, healthcare organizations can reduce costs without compromising patient care quality. Evidence-based decision-making. Incorporating evidence-based guidelines into clinical decision-making helps prevent overuse or underuse of services, which can lead to unnecessary costs or poor outcomes. Preventive care. Investing in preventive care helps reduce long-term healthcare costs by addressing conditions early before they become more expensive to treat.